How to recognize leptospirosis symptoms. Leptospirosis is an infection caused by bacterial spirochetes that affects humans and animals. While for many people and animals the infection will be mild and have no real impact on long-term health, for others the infection can become severe and life-threatening. Symptoms can look like symptoms of several other illnesses, such as the flu. When assessing symptoms that may be signs of infection, you need to take into consideration your recent activities and the possible risk of exposure. Method 1. Watching for symptoms of exposure. 1. Don't mistake symptoms for flu. Symptoms of leptospirosis can vary and can look like symptoms associated with other infections or illnesses. If you develop flu-like symptoms suddenly, don't assume it is flu if there is the possibility of exposure. Leptospirosis generally presents with flu-like symptoms including fever, myalgia, rigor, and headache. 2. Take your temperature. A high fever and chills can indicate infection because your body is trying to fight off the infection. If you feel excessively warm suddenly, or have chills, take your temperature and call your doctor. 3. Be alert to eye pain or headache. Some people experience symptoms of light sensitivity and headache with this kind of infection. If you develop a painful reaction to light or intense headaches along with other symptoms, get medical attention. 4. Take note of any itchiness. Muscle aches are a common symptom of infection too. Because muscle aches are symptoms of fever or flu as well as leptospirosis, review your recent activities before deciding these are merely flu symptoms. 5. Take seriously any feelings of queasiness. You may feel nausea with or without vomiting or diarrhea. Let your doctor know about any sudden stomach problems. 6. Pay attention to changes in your coloring. Jaundice may appear later as the infection progresses and can indicate serious liver problems. Jaundice will typically appear 4-5 days after exposure, so review activities during that time period to assess exposure risks. 7. Watch for abdominal pain. Pain in the right upper abdominal area is a symptom of second-phase infection. Often leptospirosis can develop into chronic renal disease. If you develop pain in this area, see a doctor right away. 8. Beware of any signs of rash. Sudden rash that is dark red to purple in color is symptomatic of infection. A rash that is concentrated on the lower body or palate of the mouth is specifically associated with this kind of infection. Method 2. Knowing when you should seek treatment. 1. Determine your risk of exposure. There are certain environments that increase your chance of exposure to leptospirosis. Factors like climate and land use can make conditions more favorable to the bacteria that cause this infection, so knowing where and when to be alert to those conditions can reduce your chance of infection. The bacteria that cause leptospirosis are found in temperate or tropical zones. Water is one of the most common places of contamination and infection. Urine from infected animals is also a common source. Both domestic and wild animals can be infected. These include, but are not limited to, cattle, pigs, horses, dogs, and rats. 2. Be aware of activities that put you at risk. Certain hobbies and professions carry a higher risk of exposure to infection. Know which environments can lead to exposure. Athletes who participate in outdoor sports like kayaking and rafting have an increased risk of exposure. Campers who swim or wade in contaminated water can be infected. Drinking water from contaminated streams or rivers while hiking or camping can be a source of infection. People who work in professions or industries involving animals have higher risks for infection. Veterinarians, dairy farmers, as well as workers in the fishing industry and slaughterhouse facilities all face the possibility of infection. There has also been an increase in infection rates among urban children in recent years. 3. Don't rely on symptoms alone. If you have been exposed, you may or may not exhibit symptoms of infection, so talk to your doctor about activities that may have put you at risk for infection. Depending on your history and what symptoms you do have, your doctor will decide which tests to do and if treatment should be started. Symptoms are typically nonspecific, so tests are needed to confirm infection. Signs of infection are similar to symptoms of other illnesses. If there's reason to suspect you have been exposed and you develop flu-like symptoms, see your doctor. Some people are asymptomatic and may not be affected by the infection. You should see your doctor regardless of how you are feeling if you think you have been exposed. 4. Contact your doctor if you relapse. For many people, one treatment will be enough to cure them of the infection. Some people may seem to get better without having sought treatment at all initially. However, the leptospirosis infection may not actually have been cured. A more serious form of infection may occur after a seeming recovery, usually about a week after the first range of symptoms have cleared up. For people with a more severe form of infection, symptoms occur in 2 stages. The first stage of the initial illness will be the milder form, with flu-like symptoms. The second stage will typically be more severe and last longer than the first stage. 5. Be alert to signs of second-stage infection. The second stage of leptospirosis infection, called Weil's disease, is much more severe and can have long-term health impacts, or even lead to death. This second stage can develop after the infection seems to be gone. The second stage can also overlap with the first stage of infection. At this stage, bacterial infection can cause serious damage to the kidneys or liver, even leading to chronic kidney disease or liver failure with jaundice. The bacteria can invade the lungs, posing a serious threat to respiratory health. Severe pulmonary disease, characterized as pulmonary hemorrhage, is a serious complication of leptospirosis. ARDS or acute respiratory distress syndrome is also a complication of leptospirosis. Signs of lung infection are having a persistent cough, shortness of breath, and coughing up blood due to bleeding in the lungs. Infection can also spread to the heart, causing an enlarged heart, myocarditis, or cardiac arrhythmia. Other complications may include rhabdomyolysis and uveitis. Method 3. Treating leptospirosis. 1. Take your overall health into consideration. Many people can recover spontaneously, although it usually will take longer to recover without treatment. You should take into consideration any pre-existing conditions that can increase possible damage to your long-term health. Pregnant women with leptospirosis infection have a higher infant mortality rate. Unborn babies can become infected in utero. Heart conditions, respiratory problems, or liver or kidney damage may be worsened if the infection develops into the second stage. 2. Start treatment quickly. For most people, the symptoms of leptospirosis will be mild, and the recovery period fairly short. However, should your infection develop into the second stage, symptoms could have major health impacts or even be life-threatening. Treatment can protect you from the more severe stage of infection. With treatment, infection and symptoms may last for a few days or for 3 weeks or longer. Without treatment, recovery may take several months. Some people may be completely recovered after the initial infection, but some may not. Your doctor should monitor you during recovery, and for any return of infection symptoms. 3. Contact your doctor if symptoms return. You may need to extend or change your course of antibiotic treatment if the infection is not responding to the medication. 4. Take prescribed antibiotics as directed. Antibiotics like doxycycline or azithromycin may be prescribed for milder, first-phase infections. Doxycycline should not be used in the pregnant patient. This can cause liver problems and affect the development of the teeth in the unborn infant. 5. Discuss possible hospital care with your doctor. For severe cases of infection and second-phase infection, treatment may include hospital care for intravenous antibiotics, penicillin, doxycycline, ceftriaxone, and cefotaxime, and rehydration treatments as well as antibiotics in pill or liquid forms. Method for identifying infection in pets. 1. Be alert to possible infection. Symptoms in pets can be nonspecific and vary greatly, and some pets won't exhibit symptoms at all. If your pet has been exposed to contaminated areas or other animals infected with leptospirosis, consider having it checked even if there are no symptoms. 2. Be aware of your pet's level of risk. Younger animals are more vulnerable to serious long-term damage to organs or even death. Dogs seem to be more susceptible to becoming infected than other household pets. 3. Talk to a veterinarian. If you suspect your pet may have been exposed and you see any of the following symptoms, you should contact a veterinarian immediately. Fever, vomiting, abdominal pain, diarrhea, refusal to eat, severe weakness and depression, stiffness, severe muscle weakness. 4. Seek treatment if your pet is infected. Getting your pet on antibiotics in the early stages of the infection is very important. Antibiotics will help your pet recover more quickly, lessen any damage to internal organs, and shorten the length of time during which you are at risk for infection. 5. Know what to expect. Because of the possibility of permanent damage to your pet's health, as well as your risk of becoming infected through contact with your pet, ask your veterinarian for advice and information about what to do while the infection persists. Typically, the infection will be active for between 5 to 14 days. For some animals, however, the infection can last for just a few days or for as long as several months. While your pet is infected, there is a risk of the infection spreading to you and anyone else caring for the pet. With normal daily activities like grooming, petting, walking, and playing, the risk for transmission is typically low. There is a risk for becoming infected through direct or indirect contact with urine, blood, or tissues. 6. Contact a veterinarian if your pet is not making progress. Also contact the veterinarian if your pet is experiencing problems due to symptoms from infection. Your pet may need dialysis and hydration therapy to recover.